Hi, I'm Dr. David Spiegel, Wilson Professor and Associate Chair of Psychiatry and Behavioral Sciences at Stanford University School of Medicine and co-founder of Reveri. Clinical hypnosis is the use of this naturally occurring shift in consciousness to help people with problems like pain, stress, anxiety, insomnia, to quit smoking, to focus attention. It's a useful therapeutic tool. Hypnosis has been shown in many randomized clinical trials to be highly effective. There's a big difference between clinical hypnosis and stage hypnosis, but it has some things in common. Both do involve mobilizing hypnosis. One to help you feel better and live better, the other to put on a show and sometimes make people feel silly. But the thing they have in common is that in both cases, you can try out being different and see what it feels like. Clinical hypnosis is the therapeutic use of this naturally occurring shift in consciousness to help you better manage stress, anxiety, pain, phobias, stop smoking, eat better, sleep better. Whereas stage hypnosis creates the illusion that the person running the show can control you and make you do silly things. Hypnosis is a tool that you can learn to use to help yourself, not to make yourself look silly. All hypnosis is really self-hypnosis, and we often use it spontaneously when we go into a intensely concentrated state, just get into something and really enjoy doing it. You can learn to mobilize and master hypnosis to focus better, to work better, to exercise better, to sleep better. You can use it to make your life better. Hypnosis is highly effective in helping people manage stress and anxiety. I just the other day saw a lovely woman who has had problems with mental obsessions throughout her life, and she's claustrophobic, afraid of getting in closed objects. She has to get into a PET scanner to help her doctors treat a cancer that's been recently diagnosed, and she's deathly afraid of getting into it. So I used hypnosis with her. She's highly hypnotizable, taught her to imagine she was floating somewhere safe and comfortable. She imagined, of all things, being in the Dead Sea, which is very buoyant, and being with her loving sister who calls her every day and helps her as much as she can. So I had her imagine standing by the PET scanner with her sister hugging her and viewing the scanner as a bright light that was going to help her doctors find and kill the tumors in her body. And she came out of the hypnosis and she said, I've never felt this way before when I think about getting into a scanner. I think I have the strength to do it. I can do it. And she started overcoming her fears of being in enclosed spaces and stairwells and elevators that day. And so she felt she was becoming a different person using self-hypnosis. If you'd like to learn more about hypnosis and try it for yourself, download Reveri and please subscribe for more information about hypnosis.